Last winter and spring, I was in a situation which left me pretty much immobilized due to a deep foot ulcer with not a very good sounding prognosis from the ankle and foot doctor that I met. It had gotten so deep and infected, there was a MRSA infection involved, that it was going to require either hospitalization and amputation. But home-based care was also an option. And that, in fact, allowed me to heal the infection through IV treatments. And the nurse Kristen, taught me how to do the IV treatments myself, the last 3 or 4. So the MRSA cleared, and then it became a matter of patience and very carefully seeing what movements I could make. I was encouraged by the doctor to make very few movements on my feet. So the way that we were going to deal with it was a wheelchair in the house and very limited trips outside of the house. Then we had to get the right size wheelchair because it's a narrow corridor house. So it took a couple of weeks to establish that. And so I got exercises through physical therapy that I could do in the chair. I learned to navigate the chair around the building and to do chores. But one common thread in all of this was to have that nurse, to have Kristen there frequently. And if she wasn't there, someone else that's involved in the plan. Making sure that impatient as I could get, because I love to walk, I love to move around, impatient as I could get, that this was going to be worth it, because in the long run, then I'd be able to go back to my activities. If I didn't, my chances of getting mobile again were low. Again, there was that threat of possible amputation of part of the foot. And sometime around May, we were seeing quite a bit of improvement. But there was always just a little bit more of a gap. And and Kristen looked at different dressings to try and gave me really good advice. And I had to keep myself from looking at the wound too often, how often to monitor it. And then eventually we're getting good feedback from the doctor, from Dr. Barrett. But she wanted to be absolutely sure it was healed. And then at a certain moment, I think it was might have been June 2nd, early June, it showed up totally healed, which was a step towards getting orthotic shoes. But the only sad part about that was that I was going to be discharged, because I missed the guiding light that was Kristen. So now I've been able to move around. I've been able to resume working in human services. I've been able to participate in community meetings. Been able to dance even, and I felt especially pleased going to a church festival to be able to get up and dance sufficiently well that people thought I was a good dancer. And so all of this, I would say, came about as the result of the home-based services and Kristen Cabot. And the efforts that I made, which were encouraged by her.